Acute kidney injury, symptoms and treatment. Acute kidney injury refers to a sudden decline in kidney function that causes waste products to accumulate in the body. It may manifest as symptoms of weakness, confusion, and less frequent urination. The condition is very serious and requires people to receive treatment promptly. Treatment might involve blood pressure medications and temporary dialysis, a procedure that cleans the blood of waste. Acute kidney injury most often affects critically ill individuals already admitted to a hospital. According to the research, 1% of people admitted to a hospital in the United States may experience it. During hospitalization, the incidence ranges from approximately 2 to 5%, but acute kidney injury can occur in up to 67% of those in an intensive care unit. Keep watching to learn more about acute kidney injury, including the symptoms, diagnosis, and treatment for this condition. What is acute kidney injury? Acute kidney injury refers to a sudden and frequently reversible decline in kidney function. It can happen within a few hours to a few days. People should not confuse acute kidney injury with blunt trauma to the organ, as acute kidney injury involves the kidney's microanatomy, such as blood vessels. Doctors use the KDIGO classification to define acute kidney injury. KDIGO stands for Kidney Disease Improving Global Outcomes, and it defines acute kidney injury in terms of creatinine, a waste product the muscles make, or urine volume, and involves increases in serum creatinine greater than or equal to 0.3 milligrams per deciliter within 48 hours. Increases in serum creatinine greater than or equal to 1.5 times the baseline, which has occurred within the prior 7 days. Urine volume less than 0.5 milliliters per kilogram per hour for 6 hours. The condition causes an accumulation of waste products in the blood and makes it difficult for the kidneys to maintain a healthy fluid balance in the body. It is very serious and requires prompt treatment to prevent permanent kidney damage. Early treatment enables most people's kidney function to return to normal or close to normal. However, if the condition causes severe damage, it can lead to chronic kidney disease. Over time, this can result in kidney failure called end-stage kidney failure. Causes. Acute kidney injury can occur for 3 main reasons. Reduced blood flow. Reasons for reduced blood flow to the kidneys can include a heart attack, heart failure, or other conditions that result in decreased heart function, low blood pressure or shock, organ failure, fluid or blood loss such as severe diarrhea or bleeding, overuse of non-steroidal anti-inflammatory drugs such as ibuprofen, which can help relieve pain, swelling, and cold symptoms, burns, major surgery, severe allergic reactions, injury, direct damage to the kidneys. Causes can include multiple myeloma, a cancer that affects plasma cells, a type of white blood cells, sepsis, a life-threatening response to an infection, vasculitis, a rare condition that causes scarring and inflammation in the blood vessels, scleroderma, a group of diseases that involve the connective tissue supporting internal organs. Interstitial nephritis, a condition that entails the swelling of the spaces between small kidney tubules caused by an allergic reaction to certain medications. Conditions that produce damage and inflammation in the tubules, filtering units or small blood vessels of the kidneys, such as glomerulonephritis, which affects the filtering part of the kidneys. Blockage of the urinary tract. Causes may include an enlarged prostate gland, kidney stones, prostate bladder or cervical cancer, conditions of the nervous system that affect the bladder and urination, blood clots in the urinary tract. Diagnosis. The diagnostic process has several parts. It involves a physical exam and medical history to note symptoms and their timeline of progression. This includes reviewing medications to determine if their side effects are a factor. The exam also entails checking other organs for symptoms that may indicate the cause. For example, a rash may suggest vasculitis and certain eye problems may indicate diabetes. A diagnosis also necessitates some or all of the following tests. Basic metabolic panel. This blood test measures waste products the kidney removes from the blood along with glucose and electrolytes such as sodium and potassium. Glomerular filtration rate or GFR. This blood test helps estimate any reduction in kidney function. Urinalysis. This measures protein, electrolytes and other substances in the urine. Urine output measurement. This involves tracking the amount of urine a person passes daily. Imaging. A CT scan and ultrasound provide pictures of the kidney's structure and may be helpful. Kidney biopsy. While uncommon, doctors use this to help identify a cause when multiple conditions are a possibility. It can help a doctor diagnose the cause more quickly, leading to a more prompt and effective treatment. Treatment can vary with the cause and severity of the condition and may include medications to adjust electrolytes and control blood pressure. Medications such as diuretics to maintain a healthy amount of body fluid by eliminating excess fluid through urine. Temporary dialysis for people with severe acute kidney injury. Diet changes which involve restricting fluid, salt and foods high in potassium. Prevention. The Centers for Disease Control and Prevention does not have prevention recommendations specific to acute kidney injury, but it does offer healthy kidney tips. This include controlling risk factors such as diabetes and high blood pressure, following a doctor's instructions and for taking medications, quitting smoking, maintaining a healthy weight, getting regular exercise, eating more fruits and vegetables, avoiding foods with high salt quantities, getting kidneys checked during doctor's checkups. A person who has risk factors for the condition may wish to discuss the medications they take with a doctor.